On the 20th of March every year, we ask the world to unite to help reduce the burden of oral diseases, which affect individuals, health systems, and economies everywhere. Now, Oral World Health Day aims to empower people with the knowledge, tools, and confidence to secure good oral health. Oral diseases are a major health concern for many countries and negatively impact people throughout their lives. Oral diseases lead to pain and discomfort, social isolation, and loss of self-confidence, and they're often linked to other serious health problems as well. And yet, there is no reason to suffer. Most oral health conditions are largely preventable and can be treated in the early stages. All right, so today we are chatting to Dr. Rohini Bisaal, who is a qualified dentist, graduating from the University of the Western Cape in 2017. She was also part of the Golden Key Society during her academic career. She is currently in the 6th year of her private practice, situated in Ballito in KZN. With a great passion and keen interest in dentistry as a whole, she's a general dentist, offering treatments ranging from general dentistry to clear braces, smile makeovers, and teeth whitening, to name but a few. Community is a huge part of her life, which she builds using a social media presence, therefore engaging with and providing necessary dental information on her dental page, and works with brands in general on her personal page as well. She balances her professional life as a dentist and a part-time model and influencer to not only break the barriers of having multiple careers, but also to still thrive in both. She believes strongly in encouraging the youth of today, especially females, yes, my kind of girl, to always aspire towards their dreams regardless of what society may deem as correct. Aside from her personal pursuits, it is all about just creating amazing things and working with Young Dental Council to reach out to the young dentists and share knowledge and help with overall guidance and development. On a personal level, she has a history of pageantry as well. Miss India SA First Princess 2016. Miss Uniworld Brand Ambassador 2018, international modeling and dancing, shot for the cover of Get It magazine in the North Coast in 2020, and was on many TV and radio interviews as well. Now, when she is not actively working on her careers, she loves spending quality time with family, reading, listening to podcasts, and going on adventures as well. Now, before we get into the chat with her, a reminder to our clickers that all oral health interviews will be uploaded to ClicksEd under Clicks Live Interviews. Hello, Dr. Basal, how are you today?
Hi, Robin. I am great. How are you?
I am good. I am very, very good. I'm actually glad that you are not in studio with me right now because, whenever I talk to a dentist, I got to tell you, I always think, they are looking at my mouth. They're looking at my teeth.
Well, look, it comes with the territory, but, it's not as bad as you think it is. So don't stress.
Oh, my goodness. Well, welcome to you. I'm so glad to be able to chat to you on this occasion, the World Health Day, which is amazing, right? It's absolutely awesome. Now, it's all about healthy mouth. It's all about being proud of your mouth as well. So, for you, what actually defines a healthy mouth?
So, look, the first thing I would say, Robin, is a cavity-free mouth, right? Which means that there is not enough plaque in the mouth that would ideally inadvertently lead to caries or decay in the mouth. Now, a lot of patients also don't know that you would find this mostly at the back of your lower teeth. If you just roll your tongue around that area and if you feel that there is a hardened substance on the tooth, that is called calculus, which is an increased plaque buildup that hardens in the back of your teeth, right? So that happens on a natural phenomenon, but that also is not healthy for your gums and so on. The next thing would be a pain-free oral environment. Now, pain can stem from so many different sources, which is either your cavities, your gum diseases, and so on, but it also can be trauma-induced. So say, for example, a kid fell and has fractured their tooth. So always ensuring that you are not in any sort of dental pain is one of the basic indicators of your healthy mouth and a good oral environment. The next would be a healthy salivary flow, right? So having a good salivary flow in the mouth is so important because that saliva has these enzymes in the mouth, in the substance that actually is able to neutralize the oral environment. So it basically acts like a pH buffer in the oral cavity, and it optimally basically breaks down your carbohydrates and fats, and that allows for absorption within the body. Moving on would also be for patients to have a look at their gums and make sure that they are not inflamed and they're not bleeding. Those are positive indicators for a healthy environment. Now, if you have inflamed or bleeding gums, that would normally be a sign of infection, and that should be treated accordingly, right? Sometimes your inflamed gums can be due to hormonal fluctuations in the body. For example, a lot of our pregnant patients come through and they suffer from something called pregnancy gingivitis, but that's completely normal. We just got to know how to treat it. Moving on, we would then also indicate or basically suggest that having fresh breath is also a good indicator of having a healthy mouth. Now, patients that present with halitosis or bad breath aren't necessarily presenting with a neglected oral environment. I think this is so important. But it also could be something going on within their digestive system. So especially if patients are on chronic medications or suffer from some sort of indigestion or reflux, and certain medical conditions such as bulimia are definitely some contributing factors, so we always need to be wary of that and the patient's clinical and medical history. Moving on to the last one that I would say makes a healthy mouth would ensure that the patient has minimal staining in the mouth. Now, with regards to staining, there's two types of staining.
Okay.
There's one which is called extrinsic staining, and there's one which is intrinsic staining. So I'm going to get into it now, right? Your extrinsic staining, which is indicated as external. Now, those kind of stainings come from your nicotinic stains from smoking, your teas, your coffees, and so on, right? And those can easily be removed with your dental clean and your oral hygiene and so on and so forth. However, your intrinsic stainings are stainings within the dentition and the tooth, and that can be due to overuse of antibiotics over time. So a lot of my patients will come in and they'll have staining from antibiotics. One of the most common ones is tetracycline stainings, right? And another one would be fluorosis. So if there's a high or overexposure of fluoride in the mouth, which leads to fluorosis. Yeah, that's basically a few little points that would indicate a healthy mouth.
All right, but Dr. Basal, just on your point there with the non-bleeding gums, do you mean like gums that bleed all the time, or gums that bleed when somebody is brushing their teeth or flossing, etc., etc.? Like, what exactly do you mean by that?
Sure. So say, for example, you're doing a normal brush in the morning, right? One thing I would also tell my patients is that make sure that your toothbrush is not too hard, because sometimes if you have a very hard toothbrush, it can also lacerate your gums and be very abrasive and harsh in the gum area. But if you're brushing normally, and even if you are functioning as normal and you've tasted the blood in your mouth, that's not a good indicator. But if you are, let's say, for example, flossing and you may go a bit deep into your gum area with the floss, that's more trauma-induced bleeding. So I wouldn't say that is something too bad. But I would say brushing, and if you see bleeding happening during your brushing, I highly advise maybe going to the oral hygienist or the dentist just to have it checked out, just to make sure there's nothing, how would I say, any underlying things going on that could potentially be harmful in the future.
Oh, thank you very much for that. And Dr. Basal, you spoke about having a cavity-free mouth. Now, how do we actually prevent cavities and decay?
That was the next thing I was going to be talking about. So your sugar intake, right? Sugar intake is so important. And I know there's so many patients out there that have difficulty cutting down on their sugar in general.
That's me.
Like telling them, there we go. We all have a sweet tooth. I mean, it is what it is, and I'm not saying that you've got to completely cut down sugar. I always tell everyone, everything in moderation is good, right? You don't have to do something extreme to have a healthy mouth and so on, but also find an alternative to sugar, such as xylitol. That could definitely be a step going forward to ensure that the sugar intake is not too high. And also, if you're going to be having a lot of sugar, make sure that you neutralize the environment by drinking a glass of water or having a brush. You know, those things are definitely going to help. Another one would be a genetic predisposition. Now, look, in life, we have things that are in our control and some things that are not. So say, for example, mom and dad presented with periodontitis, which is a bit of bone loss and a bone disease, or their oral environment is not the healthiest. Obviously, that can be genetic as well. So if we know these things, or even if you have diabetes in the family and so on, that affects the oral cavity as well. If you know these things, it is always so important to, be responsible enough to know that, okay, I have that genetic predisposition, so I need to take better care of the oral environment. And obviously that will help you take care of the mouth much better. Then moving on would be your medication. So some chronic medications can definitely have adverse effects on the patient's gums and so on. So, for example, a patient that has recently had an operation, and let's say, for example, they need to go on to blood thinners. Now, obviously, blood thinners is going to exacerbate bleeding in the gums. So they'll have that risk. And knowing that, we need to obviously control how we're going to manage the medications and how we're going to manage the oral environment with the medication being included as well. And lastly, I know I say this over and over again, but going for your 6 monthly dental visits, it's so important, and I'm going to tell you why, right? So say, for example, you go see the dentist in January and then you go again in July. We can then, using your x-rays and obviously clinical judgment, see whether you are prone to cavities in general, because if those cavities, for example, you didn't get those cavities sorted and it's going to be progressing in nature, or say, for example, your bleeding gums that we've treated is still bleeding in that time period, we then can gauge and know how to then treat you, maybe using another alternative to get right to the source of what's going on within the oral environment. And obviously that will then prevent anything severe from happening, such as your root canals or extractions and so on. So that's always so important.
Absolutely. Now, can you tell us why is a healthy mouth a healthy life?
Sure. So let's think about this, right? Our mouth is literally the portal to our entire body, right?
Yes.
Therefore, whatever we eat and whatever we ingest in our oral environment, that's the first line of contact.
Right.
Say, for example, if our salivary flow is not at its optimal and the salivary enzymes are obviously not working optimally, they'll not be able to break down certain fats and carbohydrates, right? So it's so important to ensure that our mouth is functioning well in that case, and we're able to break down what it is necessary from the first line of contact. Now, obviously as well, if we're going to be eating a lot of sugary stuff and so on and so forth, it's not just affecting our teeth. It's also going to affect our entire body. And a lot of the patients that I see as well, where they complain of halitosis or bad breath, as I mentioned before, it's not just a dental issue. It's a lot going on within the gut system as well and the overall internal system. So that is why it's really important.
Wow, thank you for that. I actually didn't think of it in that way. So thank you very much for sharing that. Now, what can people in general do to maintain a healthy oral environment?
Sure. So as I mentioned before, your biannual dental visits definitely so important, but I've gone through that already. But also flossing. There's so many different interdental aids out there. I know a lot of patients are not as keen or not a fan of wrapping the floss around their fingers, but there's so many different alternatives now to clean in between those surfaces. Remember now, your tooth has 5 surfaces.
Mm-hmm.
The back, the biting edge, and the front, but next to it are those 2 surfaces between the teeth that you're not able to optimally get to. So that's what flossing is so important. And then obviously brushing for 2 minutes a day, not forgetting your tongue as well, reducing your sugar intake, staying hydrated with water, that's going to definitely neutralize the environment. And don't ignore the first sign of dental pain or discomfort. I think that's a big one. But I also find that I always try to encourage my patients to have conversations with your friends and your family about your dental health. I think that can help so much. I think we shy away from having those conversations. And if you do, you can help out a friend, you can help out a family member, where you can compare what's going on in the mouth. I know it sounds a bit ridiculous, but it's really sad, you know?
Yeah.
If you can give somebody advice on maybe what works for you, you know, that could definitely help. And, you know, for example, young parents, and if they have a little one, right? And sometimes they don't know the detrimental effects of, you know, a dummy or thumb sucking and mouth breathing. And if parents can have that conversation as well, you find a common ground. So I think that's also so important.
Okay, so I'm going to go home and I'm going to have a discussion with my parents and I'm just going to show them my teeth and we're going to compare teeth. It's going to be very, very interesting indeed. Now, I wanted to ask you, you said a brush for 2 minutes a day, right? So, do we actually have to brush in the morning and at night?
Yes, you have to brush
okay.
in the morning. Very important.
So we can't do the 2 minutes daily, but like in the morning. I'm asking for a friend. I'm asking for a friend, doctor.
No, in the 2 minutes in the morning and 2 minutes in the evening. Yeah, I'm not going to break it down.
Oh, so okay. So it needs to be like 4 minutes in total. That is what you're saying.
Yeah.
Okay, I'll bring out my timer the next time I brush my teeth. Or I should just count to 120, right?
Oh, there we go. Yeah. Or just put on your favorite song. That's what I tell my patients. Put on your favorite song. Make it fun, done, and
that could work.
You're in the game.
That could actually work. That is the best tip I have heard from a dentist before in my entire life, I got to say. Oh, and that was also very important what you said there about ignoring the first sign of dental pain and discomfort. It can actually lead to so many issues if you actually ignore it. I've got to say that.
For sure. Yeah.
Even me, I'm currently ignoring something that's happening at the back of my mouth. So I need to listen to you. All right. So just another question for you. So what would you regard as good or healthy foods that will aid in actually creating this healthy oral environment for us?
Sure. So the number one thing would be water. Water. Now, water is just going to neutralize everything. So that is definitely my first thing. Then foods that are crunchy. So your lettuce, your cucumbers, and so on. That also have a high water intake as well. Funnily enough, those green leafy vegetables, they're also high in calcium and folic acid, which what the gums love, right? But they're also able to clean in between the spaces because they're nice and stringy in nature, but they're the good types of stringy. And they really, really do sort of, I would say in inverted commas, brush the teeth in that way. And then cheese and yogurt, which is also low in sugar and high in calcium. Now, calcium is really great for maintaining bone density. And cheese is also very high in phosphate, which also balances the pH in the mouth. And then moving on to the last one would be your nuts. Your nuts has calcium and phosphorus as well. Specifically, I would say your almond nuts, your Basal nuts and cashews, and those help also fight bacteria, which cause tooth decay, funnily enough, as well. So, look, it also stimulates the salivary flow, which I always go on about, where we neutralize the pH in the mouth, and that's always a key factor to maintaining a good, healthy oral environment.
Okay, Doc, I got to ask you something. You spoke about the flossing daily, the brushing for 2 minutes, etc., etc. So quite a lot of things for us to remember. But I got to ask you, if somebody is struggling maybe on a monetary or budget level, and they cannot afford to have so many things, you know what I'm saying? Because there are a lot of people that can't even afford a toothbrush. I've heard quite a lot about that. You know, there was people actually sharing toothbrushes and all sorts of things. So there are people that can't really afford so many things. So what would your advice be to them to kind of break it down and keep it quite simple for those who just don't have enough money to maybe buy lots of things?
So look, at the end of the day, what you just mentioned something important where patients are sharing their toothbrushes.
Right.
Now, I wanted to speak a little bit about that, right? Purely because, as much as we may think the work is getting done, we also are, spreading the bacteria from one mouth to another.
Right.
And that is not the most healthiest thing to do, right? But there are definitely, you get your bamboo stick toothbrushes, which are a little bit more cost effective as well.
Sorry, what was that, Doc? Your what kind of toothbrushes?
You get the bamboo toothbrushes as well that have the charcoal heads.
Mm-hmm.
Those are a little bit more cost effective as well. But always just ensuring that your toothbrush, even if it means just getting a toothbrush for now and cleaning those spaces.
Right.
And obviously your toothpaste as well.
Right.
Before getting into anything else, I think that would be the first line to help a patient just maintain a good oral environment. And if you don't have to get the fancy stuff things, and then also just water in general, just ingesting water, taking care of your diet. I always say that it's not really about the most expensive things and what all these incidental. There's so many things out there on the market right now, so I know it can be so confusing for the patient. But, having a good diet, managing your sugar intake, having a lot of water, and just getting a simple toothbrush and toothpaste for now, just to get you through. I think that will definitely help. And also, there are so many community projects, and I'm very passionate about it as well, where there's outreach programs where we go out to the areas and help the community. And that would be something, so amazing to just help out and do for everyone. I mean, we really do try as much as we can.
Yeah.
But I think that would be a great option. I mean, when I was in community service, I'm just going to share this information because it may help. There's so many community service locations. I was in another CHC, and, it's free of charge. So
Right.
people just come in, they get a dental clean, and I think it also helps where, the dentists working at those communities where they can educate the patients.
Right.
And
Absolutely.
if we can get some sort of help from certain brands, we really, really try to do that as well.
Oh, you are absolutely incredible. Thank you so much for sharing this information with us on World Oral Health Day for 2024. Now, Dr. Basal, I don't actually want to let you go because I feel like there's so many things that you could share with us. And I just love you so much because you speak my language with regards to working with young people, working with females as well, dreaming and going for your dreams, etc., which is what I also stand for and believe in as well. So before I let you go, do you have any closing thoughts for us?
Sorry, Robin, can you just repeat that again?
All right. I asked if you had any closing thoughts for us, perhaps?
Oh, yes. So, look, as you've mentioned, it doesn't have to be so extreme in what you do in the oral environment. Keeping it basic and doing what is needed and is the most, I would say, affordable to you as a patient as well is really going to help take a step forward to maintaining a good oral environment and good oral health. And, we're always here to help. I know a lot of people in general are so scared of the dentist, and I completely understand that. But, dentistry or going to the dentist doesn't have to be a bad experience.
Yeah.
We're really here to help, at least from my side, and be patient and as gentle as possible with the patient. I think one thing I also want to tell patients is that the longer you leave the issue, the more difficult it gets to treat. So don't neglect your oral environment. Your oral environment is so important. And we're here to help. And your smile is, I would say, the biggest trademark, or is your trademark. So you got to take care of that as well.
That is absolutely so true. I echo your statements there because I left a little problem at the back of my mouth here, and let me tell you, the pain is so intense. And you know what? It comes out of nowhere. It's like, okay, it's fine today, and then all of a sudden, boom, here's this pain, and I'm like, oh my goodness, I need to get this sorted out ASAP. But I'm so scared. Because this one I left so long, man.
It's the small changes. So I hope that, this helps with because look, dentistry is so underrated.
Yeah.
And, almost, actually every single day a patient will come in and tell me that they just don't want to be here, they hate the dentist. And I completely understand. Dentistry also was really rough back in the day. So we really are trying to improve that and help out and make it a much better and fun experience. That's how I like to approach it.
Yeah, but you know what, actually, Dr. Basal, the other thing is, after I went and I got my teeth fixed in the front, I got to say my confidence, it just went from 0 to 1,000,000.
That makes me so happy. I'm so glad.
It's the makeover, man, like the smile makeover that you were talking about as well. And so thank you so much for the work that you do, because it really does boost a person's confidence. It's not great to have dental issues and then you feel like you can't smile, you feel like you can't talk to people, etc., etc. So I absolutely just commend you for the work that you decided to do. So thank you very much for that.
Oh, thank you so much for being so kind and for those kind words as well, Robin. And it was such a pleasure speaking to you.